Settings for BBL Moxi on this patient. So this was after her first treatment, before her second treatment. Already an amazing improvement just after one session. It was pretty incredible. So I'll go back to what settings I used. So we did BBL plus Moxi. The first step was the 560 filter with the Hero, which is the In Motion at 6 joules. I did use the small square adapter for her full face. So sometimes I'll use the large adapter for the lower face and then switch to the small adapter. But when I'm in a hurry, I'll kind of just use the small square adapter for the full face, just getting more coverage with that small adapter. So then I do about 200 pulses per cheek because I am using that small adapter. If I use the large adapter, I'm doing about 100 pulses. So 200 per cheek, then I'm doing about 50 or so for the forehead and nose, upper lip. And then I will switch to my pigmented lesion filter, the 515, still with that circle adapter. I will do 12 joules, 15 milliseconds. And then what I'm doing is basically a 1-up, 1-over, just a traditional IPL where I'm stamping it and I'm covering the whole face. So she had pigmented lesions everywhere. So I did one pass over the whole face at this setting. Now you can go up a joule or you can go down to 10 pulse width if you're not seeing your clinical endpoint. But that's where I was at with her. And you can see down here, this is what I selected, the presets. Sometimes I'll just go into manual mode when I already know what I want to use. But when you're learning, you're going to go through the presets, right? So face, skin type 2, and she had light brown brown spots. And then my temperature was 25. I usually don't adjust the temperature because that just defaults or has a preset. So then I switched to a 560 filter. So she was mostly pigmented, right? So going back to her picture, she's got a lot of brown spots, a lot of hyperpigmentation, and she didn't really have a lot of redness. So for her, I put on the 560 filter, switched it to the circle adapter, used 17 joules, 10 milliseconds, 20 temperature, and that was for the veins around her nose, which you can't really see. Let me go back to her pictures. So you can see she's got some redness in her nose area, and there's a spot right there. I think there was a pimple, so that's why it looks more red, but hard to see in the picture, but she did have some little broken capillaries. Let's see if you can see it in this picture. Yeah, so a little vein right there. And then, so let's go back to vascular. So I'm still learning the settings for vascular to get the best results. And I do think I can probably push this to 18, 19, 20 joules, maybe 5 ms. But that's what I used on her, and it seemed to help a little bit. So then I will take off all of the gel. I will make sure there's no remnants of any gel left, and I will dry the skin. Make sure to use a little alcohol or something drying to make sure that there's no water at all on the skin. And this is what I used for the Moxi. So I used the measure feature. I switched it to 20 joules, 20% coverage, and I used pretty much 20-20 for the whole face. So right cheek, left cheek, forehead. And then I did switch it to, so I did 20-20 for the nose. If you see, there's 2 different numbers right here. There's 2 lines. What I ended up doing was I pressed the reset button once I was done with the nose. I pressed the reset so I could do around the eyes because it's going to max me out once I've completed my energy, and I'm not going to be able to do an extra pass around the eyes. I could also go back and do manual mode, but since I'm in already the measure feature, I just went back to reset, and I was able to do around the eyes. And around the eyes, I did 15 joules and 15% coverage. And I did not do a full 10 passes around the eyes. I usually end up doing about 4 to 6 passes on the patient, just depending on her skin or their skin type, or the quality of their skin if it's very thin. So this is just after the one treatment, and then just some close-ups of I have close-ups of the eyes. Actually, I don't have it here, but you can see just the eye area really improved. She was really happy with the area around her mouth. Her mouth bothers her a lot. She's got a lot of fine lines. And I did end up going in actually after, kind of in between her series. She still had 2 more to go, but I did put some filler in some of these lines that bother her, just very superficial around the mouth. But that's what I used on this patient for this result.